I've been looking at research into fatigue in surgeons, and if we could improve team working in the operating theatre, if we could improve our communication, and whether that would make things more efficient and safer.
Around the world, it's pretty much accepted that you need to do a WHO, so a World Health Organization, team timeout. But what we're really talking about is doing something before the patient's even in the room. I went into over 300 surgeries and observed them, and I took structured notes. Teams that briefed at the beginning reported better communication between the different professional groups, particularly with the surgeon. And it was the quality of communication and collaboration with the surgeon that actually predicted the safety outcomes the best. And actually, out of all of the things that I've heard from nurses, the number one thing that really burns them out and stresses them is feeling incompetent, and generally that's because they didn't get the information that they needed.
Of the things that can go wrong in surgery, which we call adverse events, around about 50% of them are preventable, and around about 70% of those are a result of poor communication and poor teamwork. And then, of course, there's the effectiveness and functioning of the hospital. For example, at Fiona Stanley, using a conservative estimate, we've worked out that in 1 year, this initiative, if it was used by all the theatres, could save $17 million.
People have said that they've done a briefing, but it wasn't effective because other people didn't actually consider it to be a complete briefing, so they were still missing information they needed. So as we expand, we want to make sure that it's embedded before we start moving on, and to keep on providing support.
So often you introduce a new policy, and you may not yourself necessarily see all the time that it's improving things. But if the data which comes back shows that you are getting through more cases, that you are, your staff are enjoying it more at the end of the day, and that patient safety has been improved, then people will take it on board.